Hi, good morning. This is Dr. Yun Han Kim. Um, I am trying the live because I figured that 2:30 p.m. Sunday London time may be a better time than the time that I was doing it yesterday, which was about 11 a.m. Central Time or Chicago time or Dallas time, and that means that already it's about um, 5 p.m., which is almost dinner time Saturday. So I figured that I would do it a little earlier, and see if just test out the market, because I think that it would I wouldn't mind doing it twice, because really we are an international group. We have a lot of people from Europe, and timing is everything. So I figured two, and ideally, of course, I want to do it one time, but um, I just want to try to do what works best for. And I realize try to do something together for U.S. and Europe is very tricky. And Europe alone has 7 time zones. U.S. has probably equal number of time zones. So this is about LDN and functional medicine and anything that's related to that. So if anyone has a question, go ahead and ask me a question to comment. I'll put there question, and then you will see the question mark, and then you can ask me questions. If you don't have questions, I'm going to go through some questions that come up. And number one, I want to just say this that um, I think that the group that we have, which is called the LDN support group, I think really we offer a lot. Um, the reason why I say that is because we have great moderators, and I also have been doing this for a long time. So it's about 20 years. And the funny thing is, I did not learn about LDN from my training. I learned it from a patient. A patient of mine came to me and said, um, "We have questions about LDN. I have questions about LDN. I would like you to do research and let me know if that's something that you are willing to prescribe me." So that's how things got started for me. And when I did the research, I could see that there were possibilities that LDN can be helpful. And in this particular person, it was the Hashimoto's thyroiditis. And what happened actually is that with the Hashimoto's thyroiditis, we had excellent outcome. And then after that, um, it just became part of my practice. And that's almost 20 years ago. And I'm just inviting more people um, to let them know that I'm doing Facebook Live. And since no one is here right now, I figured that this is a good time to go ahead and do that. So sorry, I still have difficult time doing two things at one time. So that's what it is, and I sent two threads. It's kind of interesting that the Meta universe or the Facebook universe is really really amazing. Um, I've been looking for other forum because of the increasing scrutiny of the Facebook on the health groups, and so I've been looking at alternatives, and I have to really say that I don't think there's really great alternative than Facebook. So the decision that we make is that we're going to do our best to be compliant with Facebook, which means that we're really vigilant. Then we're also looking for more moderators because um, we can be only as wonderful as good if we stay alive, and if we want to stay alive, we need folks who will moderate and let us know if they see something that is problematic. And all of us, this is a volunteer activity. We don't get paid for it, And like for me especially, I do have a job. I do have a full-time job. I have a part-time job, and this is my hobby. And so grateful that my wife doesn't kick me out of the house for doing this. So I go through the questions. I think weekend tends to be more active. This is one question says that I'm very curious about LDN being used same time as SSRI. So that goes back to the question of what is LDN. LDN is a opioid, what we call opioid antagonist. If it's opioid antagonist, what that means is going to block opioid. By blocking opioid, it it can do different things. It blocks the endorphin. That's why when someone takes a naltrexone too high, then what happens is that people have all kinds of terrible side effects. And the reason for that is because endorphins get disrupted. And most people who are functioning at high level, they say that they don't have a problem with it. I don't know what happened to those people, not in my practice. The people who come and see me, I think most of them cannot handle 4.5 milligrams. So even the ones say, hey, I'm doing really wonderful, I'm doing really great, I'll give you the 4.5, they can't handle it. I think that as a society, our endorphin level probably is not going up. It's probably going down on average, which means that the dose that we use to start LDN has to be adjusted. So in the Facebook, our group is called LDN Support Group. We have a website which is www.ldn support group, and I'll put that in the chat. So ldnsupportgroup.org. And if you're here, just let me know if you're in Europe or US because I'm targeting folks in Europe. And this is the hour that I do. And if this is a good day, good time, let me know. Because again, if ideally I want to do it one time, but I think that after this, at least in London, we're pushing it farther and farther in into like evening. I think that this just before tea time is excellent time to do this, or after tea time. But then, the other European countries like Berlin, I think is an hour ahead of London. So I thought this is a good time, and so we're doing it. If you have any questions, write it. Otherwise, I'll just go through the questions and use the questions as something to talk about. So as I was saying, naltrexone is an opioid antagonist or blocker. Opioid blocker, and the reason that matters is that if you're doing surgery, your surgeon should know about it. Your anesthesiologist should know about it. And LDN being an opioid blocker, it blocks endorphin. So if you increase the doses too quickly, what's going to happen is that you are going to have symptoms. Like today, someone wrote about their child feeling nauseous, vomiting. Yeah, and it's a terrible thing, but I've done it because I need to know what it's like. So in the very beginning, I used a higher dose, and I had all those symptoms. Stop it. It lasts maybe 1 or 2 days. It's important. I think it's important they just stop it and then wait 7 days and restart it, or wait until at least there's no symptoms and restart it. So SSRIs, and it's not a big deal. The 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 SSRI and LDN, I think, is a good match. It's good match because they work in different receptor fields. And having said that, it's a myth that one drug only talks to one receptor, but that we know of, I don't think the LDN um, talks to the serotonin system or the dopamine system. I think they can influence it, and we know that because if you have a lot of endorphins, you feel good, you feel wonderful. So if you think about it, then in some ways dopamine does that, serotonin does that. Um, Dopamine would be intense high, and serotonin would be being content, being happy over a long time, and that's how we we say it. It's not really true, I think, but LDN is probably in between the two, dopamine and serotonin. because of the endorphins have dopamine kind of response, and when the endorphins are activated, then the serotonin will be strengthened. At least that feeling is strengthened. So there's a question from a viewer that talks about mother of an autistic child, 9.5 years old, advice start LDN. I think this is a perfect example. The idea is that you have this child, and the child is autistic, and autistic really also means different things to different people. Um, there's full spectrum of autism. So I don't know, but she didn't say um, that she has um, the child's spectrum. The person said autism. So likely, I think the person has autism that most people are thinking about. But it's important to understand that really it's not easy to make heads or tail out of it. I'm posting a video that in the that I made called Optimal Brain Health. To me, it makes perfect sense to have the brain health looked at and optimized. I know that there's a story where when they did the gut testing and the child spoke, and that's one. But after that, I think that all the autistic child this doctor will see will do functional medicine testing, and there are extreme examples like that's out there. And the way that I look at it is support the whole brain. The LDN, I think, is a cornerstone treatment because it protects the brain. It's a neuroprotective. It does many wonderful things. It lowers inflammation, and through the toll-like receptor 4 pathway, which is also involved, the LDN is involved. And with that, what it can do is through microglial cells influence or regulate or modulate in, immune system so that the uh, brain or nervous system, immune system is optimized. So I would say that I would recommend to that you watch the video and understand that you have to optimize everything. So at the basic, um, it would be things like in my practice. So I'm not telling you what to do. Obviously, this is an educational program, not a medical advice program. And LDN is a prescription medicine, so it needs to be gotten from pharmacy. And we're not allowed to talk about pharmacy. We're not allowed to talk about a lot of things because this is Facebook, and we have to be respectful of the rules that Facebook imposes on us. And I'm grateful for Facebook, and so I will follow their rules. But these days, there's a thing called Google, and if you ask Google, they'll figure out like what pharmacies, and they usually have review. And if you call them and you talk to them, you also get the gauge of their level. So in UK, I think there is one in there are many compounding of pharmacies now, but there are ones that are better. So if you go to the website, for example, we list one uh, that I know, and maybe I haven't made that upgrade yet. So the other part is that there is whole idea of brain support, and the easiest way to understand this is because autistic literature, I haven't seen great evidence-based, great. Um, there's a lot of feelings about it. There's DAN, Defeat Autism Now, and some of the groups I feel like maybe they are too um, too militaristic, and I think I don't like that. I think that we just have to focus on the facts. So some of the things that I talk about in Bredesen, like Bredesen approach, recode, I think that's actually not an excellent program to use for anyone that has a brain challenge. So I had a family member with dementia, and obviously I'm a physician, and I had actually this person escorted from my home country, Korea, and come here so that I could design a treatment, make sure that that person lives with us so that I can design other portions like implement. So I played doctor, I played nurse, I played acupuncturist. Nurse just means that I'm caretaker of that person, and that person made fantastic, fantastic recovery in 3 months. So I think that if you're designing targeting autism, I think that watch my video and take notes and also study a program known as Bredesen. Um, the the core things that I look at would be things like um, omega-3 fatty acids. I think it's an excellent evidence that it's health good for the brain. I think that more and more we're finding out that the it makes a huge difference in terms of um, just brain structure. A lot of the brain is DHA, and having that I think is very helpful. One moment, I'm going to just get a drink of water. And then if you look at Dr. Bredesen's work, then you will also find all kinds of different supplements to um, to use to reboot the brain, because we're talking about people who have advanced like moderate to advanced dementia, that they're able to do get excellent results. And there are some medicinal mushrooms that help neurons form new connections, and that's what you need to do. So I think that that just saying take LDN, I think is probably not going to make that much of a difference. Take omega-3 fatty acids alone. Um, take probiotics alone, and let's just stop at probiotics. Well, what probiotics are you talking about? And my son's one of his best friends, uh, brother, is like that, and a non-verbal autistic child, and the parents just put everything into that child, and they say that he's much better, still non-verbal, but he's much better according to parents, and I think that's what parents. I mean, for us who have children, our children are really the reason why we work so hard. We want to give them everything that we can give them. So they they were both judges, and they really spared no expense. And what I learned from that experience is that what I'm saying, which is, if money could solve this problem, it would have been solved a long time ago. But what they shared with me is that they used a very complex, and they tried all kinds of different probiotics, and they did say some nuggets is that the powder ones seem to work better. Number one, write it down, powder ones, and rotating them seems to also make a difference. They had some particular one, I think, made in Japan. They really felt that's the one that made difference. But rotating probiotics actually is an excellent idea, and I use that idea in treating a lot of the more resistant GI illnesses. So my recommendation would be, if you're getting the LDN, I would love to say there's a guideline that our group has that is posted many times, is pinned, and basically we want to start, like in my practice, every child, regardless of age, I started 1 microgram. Why? Because as parent, our heart will hurt too much to see them suffer. Because in the beginning, I had to understand one, because I didn't learn this. I didn't learn this in residency. I did 2 residencies, 2 fellowships. The fellowship was with Dr. Andrew Weil in University of Arizona. So you would think they're going to teach me. No, I learned it from a patient, and then I had to learn the dosing by testing on myself. And I've learned personally that LDN is not a benign drug. There are all kinds of side effects you can trigger, dose dependent. So I think 1 microgram. Um, the question says, can you? I'm not allowed to give medical advice. Number one, over the platform. There's something about community rules. I think because I'm a provider or physician, that is more uh, defendable. But in I think the law in Facebook is you're guilty until proven innocent, and you don't get a judge, you get an AI. So um, I don't recall off the top of my head. If I did, I would say, oh, contact me, but I don't recall. But there's not a lot of probiotics that is going to be from Japan that's powder that's commercially available. But I think Google is your friend. Another tool is called Perplexity AI. If you purchase the pro version, I almost now, I used to look up everything in Yahoo, and then a friend of mine said, don't do that. When I did fellowship, this thing called Google, it's superior. And then I changed until these days. Perplexity Pro is better than Google. It's faster. It's basically you just tell it what to do. It'll gather all the relevant articles. The more information you give, the better. But it should be able to assist you, and then go to the blogs and find out what other parents are using. Like, so that's what I recommend. So let me go back to our group and answer more questions, because this will get also recorded, and once it's recorded, it's going to um, it's going to also um, be, I mean, other members can watch it also. So the person says that the person's doing VLDN, and I think the terminology all is, in my opinion, I'm going to use the S word, stupid, because I think it's better to just state the dose rather than ultra low dose naltrexone, very low dose naltrexone, low dose naltrexone. Well, in my practice, I use anything from nanogram uh, to um, milligram, and sometimes I go even higher. So I think that it makes sense to me that just state the dose rather than try to be uh, qualitative about it. I mean, you know what the dose you're taking, just say that, and then we know exactly what we're talking about. This person wants to create their own uh, dilutions, which I'll just skip, because I think there are a lot of people doing that. And if you're very interested, I think you should look it up in the YouTube video about dilutions, understand how to dilute, the concept of dilution, and how to execute it. Pretty sure that giving advice about how to dilute medication violates some rule about pharmacy. So, is there anyone helping to taper off prednisone and PMR? So, polymyalgia rheumatica is a condition that I think LDN is well equipped to handle. The concern that I have is that as people can get LDN, or they figure out how to get it, and there are places that consultant is provided for you. But that consultant works for the pharmacy, and they're there to sell LDN. They're not necessarily experts of LDN. For example, it's Sunday morning, and but I'm doing this because I love helping people with LDN. I want people to know about LDN. I want to see more people benefit from LDN, because it's people's medicine. It's cheap and often medication. Nobody makes money except, well, I guess, the compounding pharmacists. I sure hell don't get the money. So the issue I think I see is that people are trying to self-manage, or use a group like us, LDN support group, and try to get experience. I think that's wonderful. I think that combined hive mind knows more than I do, and that's one of the unpaid benefits of helping to moderate this group, is that because when people ask me a question, I don't try to. I go to the source and do the research, and then I let them know what the answer is. So LDN for PMR treatment, absolutely. The success rate would be about 66% all comers, but there's about a third that don't respond. And if you can't really use a tool that works like that part of the time, most of the time, and then count on it to taper. What I tell people usually is in principle, again, not a medical advice, but education. Get the condition as wonderful as possible. If remission is possible, get to the remission, and then discuss with your doctor, either the LDN prescribing doctor, but if that person works for pharmacy, then I'm going to discuss that, or the steroid dispensing physician. And in the our website www.ldnsupportgroup.org, we have sample letter and research papers that you can access, print, and change the letter to your name and your condition, and give your doctor a chance to review it. Listen, doctors are really busy. We are not, unless you have a doctor on your payroll, we are really, really, really busy. It's the same thing when I go to my workplace Monday, Tuesday, Wednesday. I am just until there to get out. It's like a war zone. So if someone says do research, what I usually say in my practice is, because it's a functional medicine practice, is make the appointment so that we can talk about research. And they're very gracious, and so they do. In your case, you're kind of intruding on them, so be nice, and hopefully they'll do the right thing. So, which type of doctor is helping decide what dose to start with? It should be an LDN expert like me, but there's only one of me I know that is crazy about LDN. Sunday morning, I'm doing this, writing blog articles into the night. So I think you deal with whoever is willing to give it to you. So if people have fibromyalgia, rheumatoid arthritis, chronic pain, then I think that you just go with the one that is most kind and is willing to learn. And you'll find kind and willing to learn. Um, we are endangered physicians. Most of the physicians, especially now with the attitudes of the younger people, it's just a job for them. And I can't blame them. We should have been as smart as them, but I wasn't. So it's a calling for me. It's not just a job, which is the reason I'm doing this. So this person has MCAS, mast cell activation syndrome, MCAS, and started it, and is thinking about starting LDN because of the side effects. So this goes back to the book that I was talking about. If you are prone to side effects, if you're prone to side effects, start at lower dose, lowest dose. And commercially in the US, it is 1 microgram. And I don't know, but there are people who in the US, they just can't afford it. And compounding pharmacies usually charge, used to be less than dollar a day. Nowadays, it's actually more than $1 a day. And the inflation has really caught up everywhere, including LDN. So when patients tell me, Dr. Kim, I cannot afford it, then if I do this, then I can't eat. So then I will prescribe them the regular dose, and then they can learn to dilute it. I just tell them to, because pharmacy has rules too, I just tell them just go to YouTube and learn how to do it. I don't want to get involved. If you know a pharmacist who's going to help you, that'll be fantastic. So this person says my energy and brain fog have improved a lot on LDN, but I'm developing a double chin. Any ideas why? I think that I'm glad the energy is better. I'm glad brain fog is better. And for me, when they say chronic fatigue syndrome or myalgic encephalitis, I think that the name gives you an idea. Chronic fatigue syndrome is how they feel. Myalgic encephalitis means that encephalitis just means that there's a brain inflammation or infection. So the way that I would say is that you have to, and this is my practice. If you don't sleep, you're going to be tired. So you have to optimize the sleep. If you got hormone issues, it doesn't matter what you do, you're going to be tired. So you got to look at that. Nutrition. If your nutrition is crappy, we call American nutrition Standard American Diet, or SAD. And I'm guessing Britain is not going to be that much better. Although people who went to Albania say that they love the food, their autoimmune diseases went away. Another person said, I went to Ireland and the food was fantastic, and I just didn't have food allergies in Ireland. Um, so I think there's something to EU food that might be cleaner. So this person getting a double chin, usually with LDN, in theory, you're suppressing endorphins. So there's a mechanism by which people usually lose weight, but weight loss is highly individual, and it's habitual and whatnot. So I don't think so. Well, and this is a bit of a thank you moment. I'm so grateful that we hit 8,000 members. I remember in April of 2025, I just got started. I got started because I was in between changing jobs, and usually it's the tale of two cities. When I begin, it's the best of times. When I leave, it's the worst of the times. So now, in my current job, I try to just treat it as a job. Not so it's not the best times. So hopefully, I can continue here, or even when I leave, it won't be the worst of times because when I started, it was not best of times. So let me look at if there are more questions, and I'm glad that we answered one parent's question, and that I think if I have a weakness, it's just that when I hear that there's a parent looking for um, something for their children or their loved ones, I think that it breaks our heart in multiple ways. Part of it is a role of a healer, and we are unable to assist. It's emotionally difficult, and watching your child suffer, I think, is even more difficult. Well, I'm going to 30 minutes, so if there's no further questions, I'm going to sign off, but I will give 1 minute in case someone has a question. And by the way, this format, I don't know again what time it would be the best, and and I will figure it out, and then we'll go from there. I will have a poll. Um, so if there's no further questions, I'm not seeing any. Um, I will sign off and then convert this to a YouTube video as well and multiple reels. Good day to you.